The monitors were not alarming anymore. That was the problem. When a brain flatlines completely, the machines stop arguing. They settle into a single, indifferent tone, not loud, not dramatic, just the quiet mechanical acceptance that a body has crossed a line it cannot uncross. In room 14 of the neurological ICU. That tone had been playing for 11 minutes when the night shift rookie nurse walked in and turned it off. Not because she was giving up, because she was thinking. The attending physician stood at the foot of the bed with his hands in his coat pockets. The posture of a man composing what he would say to the family. The family in this case was a 4-star admiral, a man who had buried soldiers, commanded fleets, and never once shown fear in 40 years of service, now standing in a hospital corridor outside his daughter's room with his hands shaking for the first time in his life. The rookie nurse looked at the girl on the bed. 23 years old, perfectly healthy 48 hours ago. She looked at the flatline, she looked at the chart. She looked at the IV lines, the head positioning, the angle of the neck brace. Then she looked at something nobody else had looked at. Her expression did not change. She did not call for help. She did not panic. She pulled on a fresh pair of gloves. The attending physician frowned. "What are you doing?" The nurse did not answer immediately. She made a small adjustment with her hands, precise, deliberate, the kind of movement that does not belong in a nursing school classroom, and watched the monitor for a moment. Nothing, then a line moved. They were wrong about her. They were wrong about everything. The neurological ICU at 2 a.m. had its own particular silence, not the silence of peace. The silence of machines doing the work that bodies had partially stopped doing on their own. Ventilators breathing, monitors measuring. Fluorescent light that never changed, never dimmed, never acknowledged the difference between night and morning. Time here was not measured in hours. It was measured in vitals. Maya Reeves walked onto the floor at 01:52 carrying a small thermos she would not have time to open. 28 years old, plain navy scrubs, hair pulled back efficiently. New badge, new shoes without enough wear on them yet. She had transferred in 3 weeks ago from a smaller hospital in Virginia. Nobody had asked why she left. She was a night shift nurse during a staffing shortage, welcome enough to fill a slot, not noticed enough to matter. She signed in, reviewed the board, and was already reading the incoming transfer notes before the charge nurse finished speaking. Dara Ose had run this floor for 11 years. She leaned over the counter and said without ceremony, "Transfer incoming. Room 14, priority 1, you've got it." Maya did not look up. "What time?" 20 minutes, 23-year-old female. Claire Harmon collapsed at home this afternoon. CT shows diffuse cerebral edema. She was responsive on arrival to the ER. She is not anymore attending. Voss, Dara said, and the name landed with the weight that certain doctors accumulated over years, competence and difficult personality in roughly equal measure. Dr. Leonard Voss was a neurologist of genuine skill, who had decided long ago what the hierarchy of a medical floor looked like. And he maintained it with the effortless consistency of someone who had never been seriously challenged. "One more thing," Dara said, lowering her voice. "Her father is coming with her. Admiral James Harmon, 4 stars, SEAL. He asked very specific questions when he spoke to the ER physician, very specific." They flagged it in the transfer notes. Maya looked at the flagged section. The Admiral had asked about intracranial pressure differentials, cerebral perfusion thresholds, and specific pharmacological profiles of the sedation being used. Not the questions of a frightened parent. The questions of someone who had spent time around field medicine, around the hard edges of what kept people alive when conventional support was not available. "Thank you," Maya said, and went to prepare the room. She moved through room 14 with quiet efficiency, adjusting bed angle, verifying suction, checking the emergency supply drawer. Aligning monitoring leads in the order she preferred rather than the order the previous shift had left them. She did this without comment. She had been in the room 9 minutes before the transfer team arrived. Claire Harmon came in fast, intubated, entirely still in the way that crossed the border between unconscious and absent. Young face, soft features, the face of someone who had been well and expected to stay that way, cervical collar in place, GCS of 3, the bottom of the scale, doctor. Voss arrived, reviewed imaging quickly, ordered medications adjusted, and stood at the foot of the bed constructing a prognosis toward a conclusion he could already see the shape of. He glanced at Maya once to confirm presence, not to invite contribution. Push the mannitol, recheck pressures in 30. Get neurosurgery on the phone, but tell them it is likely informational only. Maya administered the medication and noted the time precisely. Admiral James Harmon arrived at 02:31, tall. In civilian clothes, a jacket that looked like it had been put on in motion, but none of that softened what he carried in his posture. He walked into a floor accustomed to authority, and brought a kind that did not need a building or a title to exist. He stopped at the nurse's station, identified himself in 2 sentences, and asked where his daughter was. Level voice. Eyes that had learned to process the worst possible information without falling apart publicly, because that option had never been available to him, through the glass of room 14. Maya watched him stop at the threshold, watched him take in his daughter's stillness, the ventilator, the numbers, watched his jaw set, watched his hands held very still at his sides. Fingers straight, the way a person holds themselves when the alternative is something they cannot afford. She returned her attention to the chart. The numbers sat wrong. The edema was diffuse, that matched the imaging, but the onset curve was too fast for a spontaneous cerebral event. The blood pressure readings from the field showed a sharp hypertensive spike, followed by a rapid drop. And the field report buried near the back said something brief and almost incidental. Patient found prone. Rolled to supine by family member prior to EMS arrival. Maya read that line twice. She looked at the neck collar. Correctly applied, standard sizing. But the cervical spine had settled into a very slight extension within the collar, a millimeter. Maybe 2, the kind of variance that happened in a stressful field environment and was never reassessed at the receiving hospital. Because the collar being present felt like the problem was solved, Maya looked at the patient's upper chest. Under the repositioned light, she saw it clearly. Faint bilateral mottling concentrated in the upper thoracic region, not the pattern of typical cerebral injury. The pattern of venous return compromise. She stood at the bedside and held the observation the way someone holds information that has not yet become a conclusion. She knew what she was looking at. She was not entirely sure she was supposed to know what she was looking at, not in this building, not in these scrubs, not in a career that was supposed to be ordinary. She pulled on gloves and began, by 3 a.m. The floor maintained its quiet rhythm. Maya had been assembling a picture for 40 minutes. A picture the chart had not organized because the chart only recorded what people had looked for. And nobody had looked for this. The modeling pattern, the collar variance, the pressure creep that was climbing slowly, steadily, still below the formal alarm threshold, still moving. The mannitol had not produced the expected reduction. The ventilator waveform had begun, barely, almost imperceptibly, to change. She went to Voss at the nurse's station. "I have observations about Claire Harmon's presentation I want to share," she said. Keeping her voice level, no urgency in it, because urgency in a junior nurse was easy to dismiss as inexperience. She outlined what she had found. Precise language, venous outflow compromise, positional collar variance, prone recovery history, upper thoracic modeling pattern, pressure trend correlation. She did not editorialize. She presented it as clinical observations that in combination suggested an alternative mechanism worth evaluating before the current treatment pathway became irreversible. Voss listened. "The CT is consistent with diffuse axonal injury," he said. "The onset you are describing would require a very specific combination of factors." "Yes," Maya said. "I think that combination is present. What is your background?" he asked. "I transferred from a regional hospital in Virginia 3 weeks ago," she said. He waited, as if she had left a sentence unfinished. She did not finish it. He picked up his tablet. "The imaging does not support a vascular compression mechanism as the primary driver. Continue your monitoring. Let me know if there are changes." Maya stood at the station after he walked away. The weight of what she knew and what she was allowed to do with it pressing against each other inside her chest. Dara appeared at her shoulder. "Voss does not take observations from night shift nurses. You are 3 weeks in. I am not telling you to be wrong. I am telling you to be careful." Maya looked at her and recognized the older nurse for what she was, not an obstacle. But a woman who had watched the institution win arguments it should have lost and had learned to protect the people inside it. "Thank you," Maya said, and returned to room 14. She wrote everything into the nursing notes. Every observation, every timestamp, every measurement. In flat, factual language that could not be argued with, set down in a place where it could not be unseen. Outside in the corridor. The Admiral sat with his hands on his knees and his eyes on the middle distance. Not sleeping, not crying. Processing the way a person processes things they cannot change but refuse to stop measuring. Maya looked at him through the glass. She did not see a 4-star Admiral. She saw a father who had buried soldiers and never broken. Sitting outside a room where his daughter was losing a war nobody had correctly identified yet. She turned back to the monitor. The line was still flat. The pressure was still climbing, and Maya had already begun deciding what she was going to do when doing nothing became the most dangerous choice in the room. At 03:47, Doctor. Voss walked toward the family consultation room. Maya watched from the corridor. She watched the door where the Admiral had been sitting. He was no longer in the chair. He was already inside. The conversation had been scheduled without her being informed. The timeline was moving faster than she had understood. She set the chart down. She stood and thought, not frantic thinking, but fast, the kind of speed that lived underneath stillness. The pressure trend had continued climbing for 40 minutes. The mannitol had not worked. The waveform had changed further. None of these changes had triggered an alarm individually. Together, they were telling a story that the monitoring system was not designed to hear. She thought about what would happen if the Admiral signed the papers. Then she walked to the family room. She did. Not knock. She opened the door at the moment. Voss had just finished a sentence, stepped inside with the quiet entry of someone who belonged rather than someone asking permission. Voss turned. "Nurse Reeves." The tone said everything. "You are junior, you are out of place, you will leave." Maya looked at the Admiral. Admiral Harmon sat upright, jacket still on. Hands folded on the table, a chosen posture, not a natural one. His face held the composure of someone who had received terrible news in worse places, and understood that composure was not coldness, but a form of respect for the moment. He looked at Maya when she entered. His eyes were sharp and very tired. "I am sorry to interrupt," Maya said directly to him. "I have one clinical question about your daughter's history. It is time-sensitive. I would not be here otherwise." Voss started to speak. The Admiral raised one hand from the table, a small gesture. It stopped Voss with the casual efficiency of someone accustomed to stopping rooms. He looked at Maya. "Ask it," he said, in the 48 hours before Claire collapsed. Did she have any neck pain, stiffness, or report any pressure sensation in her head when she changed positions? Specifically when moving from lying down to sitting up or standing. The room was quiet. Something shifted in the Admiral's eyes, the specific shift of a person recognizing a question they had been asked before, in a different context, by a different kind of person. 3 full seconds of silence. "Yes," he said. "The morning before, she mentioned it twice. I told her to rest." Maya nodded once. She did not editorialize. She received the information, thanked him quietly, and turned to leave. Voss followed her into the corridor. "What are you doing?" "That family is in the middle of that information changes the differential," Maya said, walking toward room 14. Positional pressure symptoms in the 48 hours prior are inconsistent with a spontaneous cerebral event and consistent with a progressive venous outflow compromise. You are not diagnosing this. "Patient, no," Maya said. "I am documenting a clinical history that was not captured in the transfer intake. That is a nursing responsibility." Voss stood in the doorway of room 14 and watched her add the Admiral's answer to the nursing notes, time-stamped, quoted factual. His jaw flexed. He could not object to it clinically. A nurse documenting patient history was not overstepping, it was fundamental. He left without speaking. Maya stood at the bedside and accepted the weight of the decision she was approaching. She was 3 weeks into a transfer position. The attending had twice dismissed her. The system would not look kindly on a junior night shift nurse performing an intervention outside her documented scope of practice. She thought about the cost of being wrong. She thought about the cost of doing nothing. She thought about a field somewhere else. In another context, where the same choice had been made by someone with less equipment and less time, and the answer had been the same. Doing nothing was not neutrality, it was a choice with consequences. Those consequences belonged to the person who had made them. She pulled a second pair of gloves on over the first and moved the chair to the head of the bed. The door opened behind her. She expected Voss, it was Dara. The charge nurse stepped inside quietly and closed the door. She looked at Maya's position, the gloves, the stillness of someone who had already decided. Her face moved through several expressions quickly, then settled. "What are you doing?" Dara asked, not territorial. "Genuinely needing to understand, something that needs to be done," Maya said without turning. "And I need a witness." Dara crossed the room. She pulled gloves from the dispenser, put them on, and stood where a witness stood, close enough to see everything. Positioned so the room's camera had a clear angle on both of them. Maya looked at Claire Harmon one last time. Then she began. The first thing Maya did was nothing. She sat at the head of the bed with her hands on her knees and was still for almost 90 seconds. Not hesitating. Running a final internal verification, checking the map one last time before leaving the road. Then she reached forward and placed both hands along the lateral aspects of Claire Harmon's neck. Not gripping, not pressing, resting with the deliberate weight of controlled contact. Thumbs aligned along the interior border of the sternocleidomastoid muscle. Fingertips curving to the posterior cervical region at the collar's upper margin. Her touch was extraordinarily light. It looked to someone who did not know what they were watching. Like nothing at all. It was not nothing. What Maya was doing was a form of manual venous decompression assessment derived from a field trauma protocol developed for situations where imaging was unavailable, and the clinical presentation suggested venous outflow obstruction from positional or compressive mechanisms. It was not in any civilian nursing textbook. It was not in any standard hospital procedure manual. It existed in a specific body of knowledge, developed through specific operational experience. Taught to specific people for specific reasons. Maya was one of those people. She did not think about that now. She thought about anatomy. About the jugular venous drainage pathway, the relationship between cervical position and venous outflow, the 2 degrees of extension variance in the collar. She thought about pressure, where it was coming from and where it needed to go. With her right hand holding steady contact, she used her left to make the first intervention, a precise, controlled positional shift of the cervical spine, less than 2 degrees. Moving from slight extension back toward true neutral, achieved not by moving the collar, but by using specific manual pressure at the occipital base to guide the underlying skeletal position within. The collar's tolerance range, a movement of millimeters. 40 seconds to complete, Dara watched without speaking. Her eyes moved between Maya's fingers and the monitor. The pressure line continued its climb, indifferent. Maya did not move. She breathed slowly. She maintained the correction with the patience of someone who understood that physiology did not respond to urgency. It responded to time and precision. At 2 minutes and 40 seconds. The pressure line's upward creep slowed. It did not drop, it did not reverse. It simply stopped climbing as fast. Maya felt it in her hands before she saw it on the monitor, the fractional change in tissue turgor. The subtle softening of tissue that had been under abnormal pressure. She adjusted her left hand position by 3 millimeters and maintained the same controlled pressure vector. The pressure line steadied. She began the second component, a specific rhythmic manual. Stimulation of the cervical vagal pathway, light. Precise, timed to the ventilator cycle. Designed to support autonomic regulation and cerebral perfusion pressure while the positional correction worked from above. Not massage. A timed, anatomically specific application of pressure at precise intervals, derived from the same field protocol. Designed for exactly this mechanism, Maya counted ventilator cycles and matched her hands to them. The door opened. She did not look up. Reeves, step away from the patient. Voss, controlled. Cold, Maya kept her hands where they were. In one moment now, you are performing an unauthorized procedure. Remove your hands. Maya reached the end of a ventilator cycle, paused her stimulation cleanly at the correct interval. and turned her head toward Voss while keeping positional support in place with her right hand. "I am performing a manual positional support intervention," she said, clearly and without apology. Maintaining cervical spine alignment within the existing collar's range while monitoring the patient's response. "I will describe every step if you want me to. That is not what I am observing. Then stay and observe it more closely," Maya said. "Not a challenge, an invitation. Dara is my witness. The camera has a clear angle. Everything is documented in real time." Voss looked at Dara. Dara met his gaze without flinching. He looked at the monitor. He saw the pressure line. It had steadied. The continuous upward climb of the last 90 minutes had stopped. His face did not change on the surface, but something moved beneath it, the specific discomfort of a precise and confident mind encountering a data point that did not match its model. "What are you doing to the neck?" he asked. His voice had changed. Less authority, more question. Maya described it in the clinical language available to her, anatomically accurate, a legitimate description of what her hands were doing. The positional variance, the correction, the manual contact. The ventilator synchronized stimulation and its autonomic pathway rationale. Voss listened with his arms crossed. Running her description against his own knowledge. "That is not standard nursing practice," he said. "No," Maya agreed. "Where did you learn it?" "I have been exposed to a range of clinical environments," she said. Which was true and said nothing. Voss opened his mouth to respond. The monitor made a sound, not an alarm. Not the flat tone of brain death. A different sound, the soft two-note signal of a waveform change. The system registering that a previously flat trace had been interrupted by something worth measuring. Everyone looked at the monitor. The EEG trace, flatlined for 4 hours. The basis of the prognosis, the reason the Admiral was sitting in a family room at the end of the corridor, had produced a spike. One spike. Small, brief. A single electrical event in a brain that had been electrically silent, then flat again. The room was very quiet. Dara's hand covered her mouth. Voss stood without moving and his face went through something it did not usually go through in clinical spaces: disbelief. Recalculation, and then a controlled blankness that people use to cover the fact that they have just been wrong about something significant. Maya did not look at Voss. She looked at the trace. One spike was not recovery. One spike was a signal, the brain's first attempt to reassert itself, the smallest possible evidence that something was still there that had been written off as gone. A thread, fragile and uncertain. Requiring everything that happened next to be exactly right, she adjusted her hand position. Resumed the ventilator synchronized stimulation at the correct point in the cycle. She did not celebrate. She did not acknowledge the spike. She kept working. Voss stepped closer to the bed, his arms uncrossed. His body language moved without him appearing to notice, from confrontational to observational. He watched her hands with an attention he had not given them before. After 4 minutes of silence, he said, "The stimulation interval is that time to the inspiration or the expiration." "The transition between them," Maya said without looking up. "The vagal window is widest in the half-second between peak inspiration and the start of expiratory flow." Voss was quiet. "That is not in any protocol, I know," he said. "No," Maya said. Another silence then. Without the earlier edge, "Continue." It was not an apology. But it was something, an acknowledgement from a man who did not easily give ground, in a room where the evidence had made the decision for him. Over the next 30 minutes. The EEG produced 3 more spikes. The fourth became a short run, 4 seconds of measurable electrical activity in the left temporal region. Voss pulled out his tablet and began documenting with the urgent focus of a physician updating a prognosis in real time. The pressure line dropped. 1 point. Then 8 minutes later, another point, not dramatic. The kind of number that, to someone who understood what it meant, was everything. At 43 minutes. Claire Harmon's right hand moved. A small flexion of the fingers, the index and middle. A brief involuntary curl that lasted 2 seconds and then released. The movement a brain makes when it is finding its way back from somewhere very far away. Testing the connection between intention and body, Dara pressed both hands to her mouth. Voss performed a rapid neurological check without asking Maya to move. He worked around her hands because her hands were doing something he was no longer willing to interrupt. When he finished, he looked at Maya across the bed. "I am calling neurosurgery. We are going to need imaging." He paused. The slight tightening around his eyes gave it away. "Keep doing what you are doing until they arrive and walk me through it again, all of it." From the beginning, Maya confirmed the pressure line stability. Confirmed EEG activity was persisting. Then she began to explain, in the language of the building she was in, not the language of where she had learned it. Precise, clinical, giving Voss everything he needed and nothing he did not. For the first time since Maya had transferred onto this floor 3 weeks ago, the room felt like an equal exchange. Outside. The door to room 14 was slightly open. Admiral Harmon stood in the gap. He had come on his own, drawn by the change in the floor's energy. By the instinct of a man who had spent decades reading rooms and knowing when something in them had shifted. He stood with his hands at his sides and watched Maya's hands on his daughter's neck. He watched the monitor. He watched the pressure line coming down, point by point. His face was still composed. Military stillness, practiced and real. But his eyes were not still. They moved between the monitor and Maya's hands and back again. And in them was a recognition that had nothing to do with medicine, and everything to do with what he knew about the kind of training that produced that kind of precision. That kind of calm under pressure. That kind of willingness to hold a position while the institution pushed back. He had spent 40 years around people built a certain way. He recognized the construction when he saw it. Regardless of the uniform it was wearing, he watched his daughter's fingers move. A second time now, stronger, the index finger extending and curling slowly. Like someone reaching for something just out of reach, and the expression on his face broke in the small, private way that very controlled people break. A single compression of the jaw. A single sharp breath through the nose, contained in less than 2 seconds and sealed again. He stepped back from the door. Walked to the chair against the wall, sat down. Put his face in his hands for exactly the amount of time he allowed himself. Then he straightened and he waited. The neurosurgery team arrived at 0512 and took over room 14. Maya stepped back. Voluntarily. The intervention she had performed was a bridge, a way of keeping a door open long enough for the right people to walk through it. She had never intended to be the last word. She had only intended to prevent the last word from being spoken too soon. She removed her gloves. Her shoulder ached with the deep soreness of nearly 50 minutes of sustained, precise muscle work. She did not reach for it. She stood near the door and felt the particular quiet of someone who has done what needed doing and is now simply present for what follows. Dara stood beside her. The pressure dropped another 3 points while they were setting up, she said quietly then. "Are you all right?" Maya considered it honestly. Her shoulder hurt. She had not eaten. She was tired in a way that had layers, some from tonight, some older. "Yes," she said. Dara studied her profile. "I have been a nurse for 22 years, she said, low enough for only Maya. "I have never seen anyone do what you just did. I do not know where you learned it. I am not going to ask. But I wrote down everything I witnessed, exactly what I saw." "Time-stamped. Thank you, Dara," Maya said. Dara nodded once and went back to the floor. Maya sat at a terminal and wrote her end-of-shift notes. Every observation, every timestamp, every intervention. Every response, flat, factual language, because flat and factual was a form of protection for the patient, the record, and herself. Voss appeared at the edge of the station. The neurosurgery team considers the EEG recovery atypical. They want to review the intervention notes. I told them the nursing documentation would be thorough. "It will be," Maya said and kept typing. "I will be filing an incident report regarding the unauthorized procedure," Voss said. "I will also be noting that the patient showed measurable neurological response, coincident with the intervention, and that the intervention was performed with a documented witness and continuous camera coverage. The report will reflect the full record." Maya stopped typing and looked at him. He met her eyes briefly, then looked away. Not guilt. Voss did not trade in guilt. The expression of a man who had run the math and arrived at an outcome that cost him something, and had decided to pay it because the alternative cost more. "I understand," Maya said, at 0644. She finished her notes, reviewed them once, made 2 small corrections, and submitted them to the record. She was labeling a specimen tube when she heard footsteps in the corridor that were different from the floor's normal movement. Not soft rubber soles, not a physician's purposeful stride. A heavier step. Measured and deliberate, the walk of someone who had covered long distances on difficult ground and still moved as if the terrain deserved respect. Admiral Harmon came to the nurses' station alone. He was not the same man who had arrived at 0231. His jacket was straightened, his face had been washed. He carried the full, settled weight of his posture again, the deliberate bearing of someone who had been through the worst of the night, and was still standing because that was what he had always. Done, he stopped at the counter across from Maya and looked at her. She set down the specimen tube and waited. He did not speak immediately. He looked at her with the same eyes that had watched her hands through the gap in the door. The eyes that had spent the last hour confirming a recognition that had already been made. He was not looking at a nurse. He was not looking at a mystery. He was looking at something he had already identified. In the quiet, certain way of a man whose entire career had been built on accurate identification. "My daughter is being transferred to advanced care," he said. "Yes," Maya said. "They are using the word." Recovery, a pause. Cautiously, "That is the right way to use it," Maya said. The Admiral nodded slowly. Then he reached into the inside pocket of his jacket and placed something on the counter, set it down rather than slid it. The way you place something that had weight and meaning and deserved to land with both. A challenge coin, heavy dark metal the size of a silver dollar. On one face, a trident, the seal insignia, worn at the edges with age and handling. On the other, a unit designation Maya did not look at for long. She did not need to. She recognized the coin from the category of object it was, not just from its markings. A challenge coin was not a thank you. It was not a gift in the ordinary sense. It was recognition, passed between people who operated in specific worlds, as an acknowledgement of shared understanding, shared standard, shared cost. Maya looked at the coin for a long moment. At the worn trident, at the aged metal, at the weight it carried in both the physical and the other sense, he knew not everything. He did not need everything. He needed only what his eyes and training had told him tonight. The technique, the precision under pressure, the willingness to absorb institutional resistance without breaking. The way she had stepped toward the problem when every self-preservation instinct would have stepped away. He had spent 40 years around people built a certain way, and he recognized the construction when he saw it. Regardless of the uniform it was wearing, Maya lifted her eyes from the coin to the Admiral's face. "How is she?" Maya asked. Something softened in his expression, the particular softening of a father who had been given back something he had begun to prepare to lose. "Breathing on her own," he said quietly. "As of 10 minutes ago." Maya felt something move through her chest, swift, clean, gone. She did not let it reach her face. She held it the way she held everything too large for a hospital corridor. "Good," she said. The Admiral looked at her one more moment. Then he straightened to his full height and gave her a single, precise nod. The nod of one professional to another, across whatever distance of title and context and building separated them. Not a salute, something quieter and in some ways more complete. Then he turned and walked back down the corridor. Maya watched him until the elevator doors closed behind him. She listened to the floor return to its 0700 rhythm, the day shift arriving, voices rising. Handover chatter starting at the far end of the station. She looked at the coin on the counter. She stood with it for a moment, between who she was here and what she had come from, and let the moment be what it was without trying to resolve it. The day nurse appeared at her shoulder. Cheerful, reaching for the handover sheet. "Morning, quiet night." Maya picked up the coin and closed her fingers around it. Felt its weight, its edges, the worn relief of the trident against her palm. "Mostly," she said. She pocketed the coin, picked up her thermos, still full. Never opened, and walked off the floor without looking back. The corridor behind her was already filling with the noise of a new shift, a new day. A floor that did not yet know what had happened in room 14, between 2 a.m. and morning. Maya let it stay that way. That was always the part she preferred, the quiet after, the return to ordinary. The way the work disappeared into the record while the world moved on without needing to understand it. She had kept a door open long enough for someone to come back through it. That was enough. That was Always enough.